The avoidance of checking your nuts is a direct byproduct of a culture that rewards silence. You are treating your health like a game of chance, betting your entire future that a small change is nothing, simply because you don't want to deal with the reality of being a patient. If you keep ignoring the most common cancer in young men, you are sacrificing decades of life just to avoid 30 seconds of vulnerability in a doctor's office. That shit ain't worth it. Testicular cancer is the most common cancer in males 15 to 40 years old, and it's barely screened for, but has an almost 100% survival rate if caught early. I had a patient come in recently. He found a lump months ago, no pain, so he told himself it was nothing. He didn't come in because he was scared of the answer, and that fear almost cost him his life. So why do most men think if it doesn't hurt, then it isn't dangerous? As a doctor, I'm here to tell you that silence is actually the warning. Here's what you need to know. This cancer, when caught early, has a 99% survival rate. So why are men still dying from it? Because fear is a faster killer than the actual cancer. And too often I watch men trade a 30-second uncomfortable conversation for months of aggressive chemotherapy, all because they were too afraid to do a simple check. It's wild, and it's personal to me. And I am done letting fear win this fight. Today, I'm showing you a 30-second test that stops fear from becoming a tragedy. It's free, no appointment, no lab, and 8 out of 10 men have never heard of it. Most of the deaths were preventable. Stay with me because by the end of this video, you're going to know something most doctors never even tell their patients. Let's go. When most people hear cancer, they think older. They think it won't happen to me. But testicular cancer doesn't care how young you are. According to the 2025 review published in JAMA, this is the most common solid cancer in males between 15 and 44 years old. The average age at diagnosis is 33 years old. It's crazy, right? We're talking guys in their prime, athletes, dads, college students, young professionals getting hit with this. About 10,000 new cases every year in the United States, 75,000 globally. And here's a number that should stop you. Only about 600 deaths per year in the United States. 600 out of 10,000? That means almost everyone who gets diagnosed survives this. But that also means every single death is one that likely didn't have to happen. This cancer, when caught early, has a 99% survival rate. 99%. That's not a typo. But when caught late, that number drops dramatically. So the question is, why are men still dying from this? I've been doing this long enough to tell you exactly what happens in the exam room. A guy comes in, could be 22, could be 35. He noticed something a few months ago, maybe a lump, maybe one side felt heavier, maybe a dull ache he just brushed off. And when I asked him why he waited, it's always the same answer. It didn't hurt. I figured it will go away. I didn't want to find out something was wrong. That last one is the one that haunts me. Research shows that almost 27% of men don't check because they're scared of finding something. Think about that. Fear of the answer is keeping men from asking the question. And here's where it gets medically serious. A 2025 study published in JAMA found that the average delay from when a man notices something to when he finally sees a doctor is between 12 to 15 weeks. 3 months, almost 4. That's 3 to 4 months when a treatable cancer can quietly spread and become a much harder one. And here's something that really gets me. Only 13% of US adults correctly identify that this cancer primarily affects men under 40. Most men think they're too young to worry about cancer. That false sense of security, that's part of what's killing people. And in communities of color, my communities, that delay is even longer because we're already less likely to go to the doctor in the first place. That's a system issue, and that's part of why I make these videos. Now, here's the part that shocked even me. A 2025 observational study published in the journal Medicine looked at family physicians, my colleagues, me, and what they knew about this exam. Are you ready for this? Nearly 58% of family physicians did not know how to perform a testicular self-exam, and 71% did not recommend it to their male patients. So if your doctor never mentioned it, it's not entirely your fault. And honestly, not your doctor's fault either. And I'll tell you why in a bit. The awareness gap starts in the medical system itself. That's why I'm here to give you what the system missed. Okay, so what's the test? It's called the Testicular Self Exam, TSE for short. And I need you to understand this is not complicated. This is not embarrassing. This is just awareness. The goal is simple know your baseline so you notice when something changes. Here's what you're looking for a small, hard lump, often painless, swelling or enlargement, a feeling of heaviness, a dull ache in the lower abdomen or groin. And this is key. Most early testicular cancers are painless. That's exactly why they get missed. You feel nothing, so you assume everything is fine. But it's not about pain, it's about change. Now, let me address the controversy because there's something happening behind the scenes of medicine that you need to know about. Here's where it gets interesting. The U.S. Preventative Service Task Force, the official government panel, put out a grade D recommendation against routine testicular cancer screening. Grade D, that means don't do it routinely. And honestly, that recommendation confuses a lot of men and even most doctors. Let me break this down because the nuance matters. Their concern is about screening men with no symptoms, doing ultrasounds on everyone, and the anxiety and unnecessary procedures that could cause. I get it. That's a real concern in medicine. But here's where I and many urologists and cancer specialists push back. A recent large study out of Israel, following over 300,000 adolescents, found that even a physician performed clinical examination had a sensitivity of only 40%, meaning doctors doing the exam in the office miss 6 out of 10 early cancers. But, and this is the critical part, that doesn't mean that you shouldn't know your own body. In fact, a microsimulation study published in Cancer Medicine estimated an annual self examination between ages of 20 and 30 could prevent approximately 20% of testicular cancer deaths. 20%. That's not nothing, that's lives. And urologists have formally petitioned to change the USPSTF grade from D to I, meaning insufficient evidence, arguing that the diagnostic delay of 12 to 15 weeks could be dramatically shortened by just basic awareness. A self exam is not a medical procedure, it's you knowing your body. And the difference between stage 1 and stage 3 is not just a number. Stage 1, 99% survival, often just surgery. You go home, you heal, you move on with your life. Stage 2, 99% survival. Stage 3 drops to 85%. And the treatment at stage 3, chemo, radiation, and years of follow up. Long term side effects that follow you for decades cardiovascular disease, hearing loss, nerve damage, and infertility. 70 to 75% of cases are caught at stage 1. But delayed presentation shifts men into higher stages that require far more aggressive treatment. That gap between stage 1 and stage 3, that's the gap awareness feels. All right, let me walk you through this. 30 seconds, once a month. That's it. Best time right after a warm shower. The heat relaxes everything, makes it easier to feel clearly. Step 1, cup each testicle gently in both hands, index and middle fingers underneath, thumbs on top. Step 2, slowly roll it between your fingers. You're feeling for texture, firmness, any new lumps. Step 3, notice the epididymis, the soft rope-like structure along the back. That's normal, you feel it every time. Don't mistake that for a lump. Step 4, compare side to side. It's normal for one to hang a little lower or feel slightly larger. What you're watching for is change from your own baseline. Red flags to look for: a hard lump, even pea-sized, a change in size or firmness, unusual heaviness, a dull ache in the lower abdomen or groin. If you feel something new, don't panic, but also don't wait. Go see your doctor. The workup, per the latest NCCN clinical guidelines, starts with a scrotal ultrasound. And that ultrasound can detect lesions as small as 2 to 3 millimeters with over 90% accuracy for distinguishing cancer from benign masses. Your doctor will also check blood markers, AFP, beta HCG, LDH, and if needed, refer you to a urologist promptly. You don't need to diagnose yourself. That's our job. Your job is to notice. Now, most men can get this, but some of you are at higher risk and really need to hear this part. If you had an undescended testicle as a baby, even if it was corrected with surgery, your risk is 4 to 8 times higher, period. Talk to your doctor. If your dad or brother has had testicular cancer, the relative risk for first-degree relatives is 4 to 8 times higher. Same urgency. If you've had testicular cancer before, your risk for the other side is 12 times higher. Here's something from the research that surprised me. Regular, long-term cannabis use more than 10 years has been associated with a 36% higher risk based on published meta-analysis. I'm not saying don't use it, but kind of. I'm saying know your body and check yourself. And here's the community piece I can't leave out. Testicular cancer incidence is rising fastest in Hispanic men and is projected to be the highest of any group in the US by 2026. Black men, Native Americans, Filipinos face higher death rates from this cancer. Not because the cancer is worse, but because of later diagnosis and less access to care. And one more thing most people miss: men with fertility issues or a history of undescended testicles have 3 to 20 times the incidence rate of the general population. If that's you, this exam isn't optional, it's essential. I grew up in Long Beach, my community, Pacific Islander, family from Guam, men who worked hard, didn't complain, pushed through. And that strength I respected deeply. But there's a version of that strength that kills us. The I'll handle it later, the I don't want to bother the doctor, the it's probably nothing. That's not strength, that's avoidance. And avoidance has a cost. As a family doc, I've seen it. I've watched young men younger than me, come in with something that could have been caught 6 months earlier. And now the road is harder. Here's the reality of that harder road. 57% of testicular cancer survivors use mental health services. Nearly half develop anxiety. A third deal with substance issues, cardiovascular disease, hearing loss, infertility. These are long-term costs of catching it late. And none of this accounts for what it does to a family. This video is for every man who brushed it off, for every father, son, partner who needs someone to forward this to them. Because with testicular cancer, there is a window, a beautiful, wide, forgiving window where it's caught early. And you get your life back with almost no interruption. Don't miss that window. And here's what I need you to do right now. 1, share this video. You don't know whose life you're saving. 2, check yourself this week after your next shower, 30 seconds. 3, if you found this video helpful, watch this next video on why Americans are getting sicker. I'll see you in the next one.